Infectious disease physician Dr. Sajal Tana, like many in her shoes, are doing their best to keep up with the Delta surge. It's a sign that COVID-19 herd immunity is becoming more and more out of reach.
The number for the herd immunity is dependent on how easily the virus can be transmitted.
Delta is a different beast. It's more contagious. And this all comes down to something called the R0. It's a number that shows how contagious a virus is.
Jason Farley with Johns Hopkins breaks it down. Before Delta, COVID's R0 was closest to Zika virus, or HIV.
We thought it was around between 1.5 to 2 to 3, depending on the estimates.
In other words, one infected person, on average, got 2 to 3 other people sick. But now with Delta,
we're seeing it again, that R0 of 5, 6, 6+.
Meaning slowing spread and getting herd immunity just got much harder. Another way to put it, think about infectious diseases on a contagious ladder. With Delta, it's about 2 rungs down from the likes of measles and whooping cough. For measles, experts say some 95% of folks would need vaccinations for herd immunity.
If we mean by herd immunity, you're just not going to see any COVID in your community. It may require 95%, a number we probably can't get to until we start vaccinating kids.
Every expert Newsy spoke with across the country, East Coast, Midwest, West Coast, shared the dire concern. In this vaccine versus variants race, we are behind. In parts of the country with higher rates, it means not fully overwhelming hospitals and COVID units yet.
You're seeing a much greater struggle in states like Florida or Louisiana right now because they are nowhere near herd immunity. The population is not protected, and that's why we're seeing such a massive surge. The big concern is that spillover effect. With modern travel, it's very easy for one part of the country to share things with another.
In other words, Delta means a big step back, with the slightest weak spot causing more COVID spread.
If we don't control this virus and if we don't get ahead of it, we will be talking about the need for not only boosters, but possibly even different vaccines moving forward.
This doesn't mean, though, that Delta's rendering COVID vaccines useless. Those shots could be the difference between a visit like this and one in the COVID ICU.
We are seeing a rise in COVID infections in both vaccinated and unvaccinated people. The difference is that the unvaccinated patients I'm seeing are so much sicker. Having a breakthrough infection is still really miserable, but I'm not seeing those people in the hospital and I'm not seeing them on life support.
For Newsy, I'm Lindsay Thies.